of Healthwatch Oxfordshire. Welcome to everyone for coming to hear about the activity of Healthwatch Oxfordshire during 2025-26. This has been a busy and eventful year with a lot of uncertainty about the future of independent public and patient voice. It has been business as usual, however, for Healthwatch Oxfordshire, and we continue to listen to the voices of people in Oxfordshire about the health and care in this context of change. I would like to thank all of those who gave us their views and to everyone who has supported us with our work, including community and voluntary groups, health and care providers, system partners, as well as our staff, trustees and volunteers. Working together is really important to help support and improve health and care services. Today, you will hear from the Healthwatch Oxfordshire team about some of the incredible work we have been doing in the past year. Please do take a look at our annual report, which is available online on our website, or for a much more detailed view, or you can ask for a printed copy if you would like one. There will be a chance at the end to ask questions and place comments. Please put questions in the chat or raise your hand, and hopefully we'll have time for everybody to say their piece. Now I'm going to hand over to Veronica to start the session.
Hello, it's lovely to see everyone on this really hot day. I hope you're surviving the heat. So, as many of you know, Healthwatch Oxfordshire is your local independent health and social care champion. We gather and represent the views of patients and people who use health and care services and share that feedback, share your voice with decision makers to drive improvement and inform change. We work collaboratively with health and care services. We also provide trustworthy information and support to help people understand how the health service works and how to navigate that. If we move to the next slide. We do this in lots of different ways. As you may have seen, some of us out on the streets across the county, in rural areas, urban areas, shopping centres. We do surveys on particular themes. We run focus groups. We have a feedback centre on our website, which enables people to comment on health and care services, including everything: dentistry, pharmacy, and primary care, hospital care. We also carry out enter and view visits into health and care facilities. We try and reach all communities and really make sure we're listening to people who don't always have their voice, and that involves building relationships both with communities, community groups, patient groups, residents, but also collaborative and constructive relationships with commissioners, providers and committees to bridge that voice into the system, the health and care system, so that we're not just about the listening, we're about trying to identify where change can take place and working to support that change to take place. Next slide. So we've had a really busy year, as usual. This is just some of the highlights of our year. Over 4,500 people have shared their experiences with us about a range of health and care services, and that's through our projects, through our focused areas of work, and also through the work we do listening to people and picking up on themes that are coming out from communities themselves. People also come to us for advice and information about health and care services, and that helps people coming with challenges, problems, uncertainty, needing a bit of support, and we help people navigate and understand where the best place for them to go is. People can also submit a review, as I've said, using our feedback centre, which is an online facility and also in paper form. Anyone can do that, and we encourage people to always bring their voices to us. And then we have a really strong communication where people can sign up to our newsletter, they follow us on social media, and this helps people keep abreast of everything NHS and social care, the changes going on, strategy, but also important public health information and other things that are going on in Oxfordshire. Next slide. So we've published 33 reports this year. Those reports all highlight what they bring the voices of people to the fore in their own words, in rich insight of lived experience of health and care services. And they also focus on impact and trying to recommend where change can happen based on what we've heard. We've also commented formally. We write formal letters. We've commented on NHS 10-year plan. We've commented on the local government review. We've also fed what we've heard into national and local strategy, including the women's health strategy nationally and the men's health strategy and the reproductive health strategy. So people's voices really do go to where change can be made. We're only 6 members of staff. We're not full-time. We've got 3 great volunteers who act as ambassadors at committees, and we've got a really dedicated trustee team who support and steer our little organisation and our charity. We, Healthwatch Oxfordshire, currently hold the contract for delivering the Healthwatch contract, and this is via central government down to county council. But we also bring in additional funding to enhance our engagement across the wider health system. So that was with the what was the Buckingham, Oxfordshire and Berkshire West ICB, Integrated Care Board, and now is Thames Valley ICB. And we also gain specific funding for one-off projects such as community research, and we've just recently undertaken some insight gathering on rural inequalities. So the next slide, I will hand over to Catherine. Oh, no, it's me. Sorry. Yeah, so as Barbara alluded to, this has been quite a challenging year for Healthwatch, as it has for a lot of people across the health and care system. There's huge change going on at all different levels, and that's both with a potential local government review, but it's also driven by the reorganisation of the NHS, the changing footprint of the way decisions are taken and the populations that are being served. So we heard last year there was a report called the DASH report, which highlighted the sort of pathways that patients could use to influence change and bring their voices into helping form and develop healthcare services. In the NHS modernisation bill and in that DASH report, it was highlighted that Healthwatch England and local Healthwatch, of which we are one, will be abolished as this Act passes through Parliament. It's uncertain. There's been a lot of local support for exploring and maintaining an independent voice in Oxfordshire, and we really value that, and we really want to be part of that discussion. Just to say, you know, I think Healthwatch Oxfordshire, we're here, we're working, we're listening. We've got huge skills and expertise in engagement, in listening, in pulling together that collective oversight of pathways across health and care, both from people we might not normally hear from and also from our population across Oxfordshire. So we're here to work with health and care system. We're here to offer our skills into the future, and we're continuing to work during this year. And I think just to highlight trust, independence of patient voice, and also that collecting of unsolicited views and bringing that voice into the health and care system must remain at the heart of any changes. So if we go to the next slide, I'm passing on to Catherine.
Thank you. Hello, I'm Catherine. I'm Research Lead at Healthwatch Oxfordshire. I'd like to tell you a bit now about some focus projects that we've done this year, particularly to make sure that we hear from those who are more likely to experience health inequalities and less likely to have their voices heard, and how we've worked with people and communities to support them to share their views and make change happen. So we use different ways to do this, including targeted outreach. It's lovely to see lots of people from community groups we've worked with here today, and community research projects where people use a community research approach to do insight gathering into topics that are important to their own community. So 3 ways that we've done that this year. The first was working with Derek, who's a member of the local Cantonese speaking community. We got in touch with him through an outreach visit to the Happy Place, the Oxfordshire Older Chinese People's Centre, where we heard about some barriers that people were facing to accessing care. So Derek carried out interviews to look into this in more depth, and really gathering that rich qualitative insight that Veronica's mentioned from those really in-depth conversations with people who he had a trusted relationship with. Through that, we heard about various experiences of health and care services, but particularly about challenges with accessing interpreting for GP appointments, but also at the point of triage when making an appointment, meaning that some people had been waiting for months for their first appointment. We also heard that people wanted to be reached through text messaging, but also through outreach and building relationships with the local community groups. So we're working now with Derek, the Oxfordshire Older Chinese People's Centre, and local health and care services to put together a translated leaflet, as well as hopefully a roadshow for services to build those connections with local Cantonese speaking people. We also worked with the Sunrise Multicultural Project, who run lots of community groups in Banbury, Neathorpe and Ruscott. They wanted to hear from some of the women's groups they supported, who are predominantly made up of South Asian women, about cancer screening, diagnosis and prevention. So we worked with Naseem Hussain and the rest of the team at Sunrise to carry out focus groups to hear from the women in those groups. Again, we heard about a range of services and both positive and negative experiences, but challenges including interpreting and people feeling like they weren't always believed or listened to when they raised concerns, for example, about cancer. We did hear that women really knew and understood the importance of attending screening and did a lot in their communities to encourage other people to attend, but they also wanted to know more about cancer prevention and self-checking. So we supported Sunrise to hold a Q&A with Sam Evans from the Oxford Breast Imaging Centre to answer questions that the women had, and that's now been written up as a leaflet, which is available in Urdu and Punjabi to be shared by the women with their communities and also across the county. We were also commissioned by Healthwatch England to hear from trans, non-binary and gender diverse people about their experiences of GP services in Oxfordshire. This is a group, we actually have the highest proportion of trans and gender diverse people outside London here in Oxfordshire, but they're at significant risk of mental health and physical health poorer outcomes. So we used our trusted local relationships and networks, as well as outreach at Pride events and other community groups to hear from people. And heard about, again, a really mixed picture of care with some really positive examples of gender affirming supportive care from GPs, but also quite a postcode lottery of support with some people really struggling to access any gender affirming care at all through their GPs. We shared that with the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Boards, who made commitments to improve training for GPs on trans-inclusive care and to create an LGBTQ plus page on their engagement platform. I'm going to hand back to Veronica now to talk more about health inequalities and community research.
So, Healthwatch Oxfordshire has really pioneered the community research approach since 2018, and that's all about making sure that we're hearing from communities and groups that might not normally have their voices heard. And it's a relational thing. We work very closely with community groups, particularly Oxford Community Action, who have helped us hone and pioneer this approach in the county. And others, of course. And it's all about enabling communities to identify what's important to them around health and social care and the wider determinants, and to focus on that, but also to do their own research, learn the skills of of researching, analysing, listening and reporting. And then it's an action research cycle, so it ties into identifying where change can be best made, and also where and who to go to, both within communities but also within the decision makers. And Oxfordshire has really moved ahead in this approach of listening to communities with, for example, the focus on health inequalities across the county and the Well Together programme and things like that. So community research really enhances bringing that voice into those forums. And I'm really pleased to see Nazar and Jabu and others here today who worked with us. We were funded by the Oxfordshire Community Research Network over the winter, working with Nigel, Carter, McKenna, OCA, representatives from wide range of grassroots communities over the winter, and we've developed together, very much owned together, this very practical how-to guide for community research. It's unique, and it is for communities, by communities, about how they can do community research, and we'll shortly be rolling that out to offer community research training in the coming months as well, based on using that how-to guide. So the next slide. Another thing we have done and supported or led and done collaboratively with a lot of those groups and OCVA, Community First, Oxford Community Action, Flows and others, was to make sure that the voices of community members were very front and central to Oxfordshire Marmot work to tackle health inequalities. So last summer, many of you were there, we held a community-led and community-planned event which brought community members and decision makers to celebrate, to showcase, to have dialogue, to build those relationships around the work and strengths and assets in our communities and how they are central to driving change in health inequalities. So that was a really great event. Unfortunately, this year's event was we've had to cancel because of leaky roof, but we're going to be presenting some of that work this Friday at the public health event that's coming. So I'm going to hand over back to Catherine now.
Thank you. Yes, as Veronica previously mentioned, our role means that we have a holistic overview of health and care services, which means that we can look not just at specific services and the feedback people have about that, but also people's experiences of navigating different services, getting referrals and waiting, or their experience of how joined up care is between health and social care. So some examples of ways that we've looked at this include last year hearing from over 680 women and people who use women's health services about women's health services in Oxfordshire, using a survey and focus groups with community groups. We heard about some really positive experiences of care, but also some real challenges where people's experiences were compounded with a lack of understanding from health and care professionals about women's health needs, people feeling like they weren't listened to, and then that combined with waiting lists, meaning that some people had been waiting for years without getting the care that they needed. Obviously, we don't want to just hear that, it needs to have impact. So we shared this with local providers and commissioners. It was used to shape the Integrated Care Board's women's health strategy, as well as feeding into national strategies, as Veronica mentioned. And more tangible impact, we're really pleased to see Oxford University hospitals produce improved resources for people with women's health concerns, including pelvic pain. And we worked with the local community gynecology service and Oxford Community Champions to run a menopause webinar and produce a leaflet to help improve understanding and awareness of menopause symptoms and what treatment's available. We also want to make sure that our research is really timely and relevant so that it can have the best possible impact for patients. So So as part of the proposed shift from analog to digital, in part of the 10-year plan of the NHS, we did some research into people's experiences of digital healthcare and particularly using the NHS app. So for this, we heard from over 800 people across the county using a survey, but also extensive in-person outreach to groups, to digital cafes, and out on the street and in Cowley Centre. We heard that some people really find the NHS app helpful and helps them feel in control of their health, which is brilliant, but there were some real gaps. We spoke to people who hadn't heard about the app or didn't know how to use it or faced barriers around access to the internet, technology, smartphones, or having confidence or the language skills to navigate the NHS app confidently. This has informed Oxfordshire County Council's digital inclusion strategy, as well as the Integrated Care Board's strategy on this, and we welcomed commitments from the Integrated Care Board to continue supporting digital cafes around the county. We also do projects shaped by what we're hearing from people. So one example of this was hearing about people's experiences of navigating urgent and emergency care services when they had a health concern that needed immediate treatment. So we heard from 300 people about this and heard that while there are really good examples of care, the experience of finding the right place to go can be really confusing. And having shared this with system partners from across health and care services, we're really pleased to see a commitment to improving consistency of information across the board and services working together to make sure that that happens. We also use what people tell us in feedback to make sure that that has, again, the best possible impact that it has. And because we have the role we do, we're able to pick up patterns and trends across all these different pieces of feedback rather than just looking at individual experiences. So some examples of where we've done this has been pulling together all our feedback on GP services this year, particularly around access challenges, and hearing about the musculoskeletal service, which is delivered by Cora Health in Oxfordshire. And that pulled in some insight that we also gathered from Enter and View reports, which my colleague Carol will speak more about in a moment. We've also pulled together insight on mental health that we've gathered through extensive outreach and shared that with the Mental Health Prevention Concordat to inform their provision going forward. And we summarised what we heard from a day doing outreach in Didcot Town Centre in Great Western Park and giving that place-based perspective of what experiences people are having. I'm going to hand back over to Carol now to talk about Enter and View.
Hello, everyone. My name's Carol. I'm standing in for my colleague Amir, who normally leads on our Enter and View function and unfortunately can't be with us today. I will put some links in the chat to our Enter and View reports, just so you can give you a flavour of what we've done. So I think for those of you who aren't aware that under the Health and Social Care Act 2012, Healthwatch, local Healthwatch has the power to enter and view premises where public money is being spent on NHS and social care services for those over the age of 18. So this could be your local hospital, it could be a residential care home, GP practice, dentist, optometrist. And I think it just gives us an opportunity to observe and talk to people using those services on the day of our visit. It is not an inspection. We don't inspect. It really is the experience of those people we speak to on the day we visit. So when we go and do a visit, we will talk to people, we'll observe the surroundings where the service is being delivered in, and we'll make some notes on our observations about that. And we will also talk to patients, and we will talk to carers, families, and we will also talk to staff, because staff also are important and know what goes on within their service. So it just gives a real rounded view of what's happening. And I think the reason we do that, it just helps us to identify how that service is operating, what's best practice, are there any things that, make a bit of concern? We report back what we hear about quality of the service. We'll do that on the day, and we also will do a report. Our visits are carried out by what we call authorised representatives. So they're trained volunteers and trained members of staff who are fully DBS checked and go through comprehensive training to enable them to become an authorised representative. And as I've said, you know, based on what we've seen here on the day, we do provide reports back to the service user. We give them 20 days to respond to our reports, which is providers have a statutory duty to respond to us within 20 working days on the contents of our reports and our recommendations. Once the report is published, we put the provider response in that report, and we will share the report with the service provider, the commissioner, the Care Quality Commission, Healthwatch England. I think in the last year, we've made 11 enter and view visits. So, you know, again, as I've talked about hospital wards, care homes, we did Cora Health that Catherine, my colleague, was talking about earlier, the MSK service. I think just a sort of a very brief case study. So, you know, it's great we have this power, and you're probably thinking, oh, that's great. So what? I think the so what is we visited Wintle Ward, which is a 16-bed acute inpatient psychiatric unit for women. We talked to service users, we talked to staff, we talked to families, we observed the service being delivered. And I think based on what we heard, we made some recommendations about creating a more welcoming environment when people are brought into the ward, more inviting, about providing some clear information about accessing the interpreting service, and ensuring that an up-to-date activity schedule is on the board each week. And that may sound very, you know, not really a massive change, but for those people within that ward, that made an impact, because people we spoke to talked about, you know, we find out what's happening in the ward or at the early morning round. But if I don't want to go to the early morning round, I don't feel well enough or just don't want to, I can't find out what's happening on that day. And so by putting the activities on a board for the week, it just enabled people to dip in and dip out of what activities they wanted to take part in, but it also gave them the information they needed, so it empowered them. So again, it doesn't seem a massive change, but the impact for those people within that unit was quite significant. So thank you so much for listening to me talk about EMEA's work. I'm going to now hand over to my colleague Vicky, who's going to talk to you about how we communicate our work.
Hello, I'm Vicky. I'm the communications lead, and my role is to raise awareness of who we are and what we do so that more people know how to share their views and feedback with us and how to access our help and support. We work really hard to communicate our work as widely as possible so we can reach as many people as we can, especially those that we might not usually hear from. I'm going to really quickly run through some of the main ways in which we do that. Our website is one of our main communication tools. That's where we showcase all our news, events, projects and reports. And late last year, we launched a new website, which was a really good opportunity to update the look and feel of the site and make sure all the content was up to date. The new site has loads of really useful information, including a help and support section with advice on how to access and navigate local services, as well as a directory of useful health and care organisations, services and links. There's also up-to-date information about all the latest changes and developments in health and care, both locally and nationally. The website is also home to our feedback centre, and that's where people can leave a short anonymous review of their experience of using a local health or care service. We share these reviews with providers of the service so they can see what's working and what could be improved. This year, 562 people submitted a review of their experience via our feedback centre. We also send out a newsletter every fortnight, and we're active on social media, posting regular updates on Facebook, Instagram, LinkedIn, Blue Sky and Threads. We found social media another good way for us to connect, engage with communities and reach out to new audiences. We also run a programme of regular webinars, which give people the opportunity to hear directly from local decision makers, learn about local services and developments in health and care. Over the last year, we held 6 webinars attended by 256 people. We covered topics including living well in Oxfordshire, cancer care and support, and let's talk about menopause, showcasing local services and support that's available. We also explored some of the bigger system changes going on, including neighbourhood health and the 10-year health plan for England, helping people understand what these national developments might mean locally. Our final session, Putting Marmot Principles into Practice, highlighted some of the great work going on in our communities to help tackle health inequalities. You can watch all the webinars on our website, and we'll put a link in the chat to those. We are mindful that not everyone is online or wants to receive information that way, so we also produce posters, flyers, and leaflets about our work. We share our news with partner organisations and community and parish newsletters. We offer paper copies of our surveys, reports, and feedback centre form. We've also started producing visual short summaries of our research reports just to help make our work a bit more inclusive and engaging. Accessibility is also really important. Our website uses the Recite Me tool. We offer translated materials, and we also produce easy read versions of all of our research reports. And again, they're all on our website if you want to take a look. I'm now going to hand back to Carol, who's going to talk about our information and advice service. Thank you.
Hello, everyone. So, as you know, my name's Carol. I lead on information and advice within Healthwatch Oxfordshire. This service is a statutory function of the organisation, of all local Healthwatch. We have a wealth of information available on our website to help people find right support they need, include, from how to complain about your healthcare to supporting send children to look after their own teeth. I think it's great to have a web resource, and it is a really good resource to have a look at, I think, but we are also aware that not everybody is digitally enabled, and we're always happy to talk to people on the phone. Give us a call anytime, and I've just put our telephone number in the chat. I think the main issues that we heard about last year will probably not be a surprise is access to GP services, barriers to GP care, and digital exclusion and interpreting services. I think just some examples that we heard about access to GP services, making appointments can be long-winded. When I visited the surgery to ask for an appointment, I was told to go home and wait for a text message. I think somebody else said that husband's having to wait 5 to 6 weeks just for a telephone conversation. I think barriers to GP care, digital exclusion, interpreting. When I try and call the practice, they tell me to use the app, but I struggle to use the app. The reception staff could just pick up the phone and talk to me when I want to book an appointment. I think somebody else just said it puts me off making an appointment. If I was poorly, I'd probably just ring 111. I think, again, it's that so what, Catherine's talked about impact. And I think it's just thinking about all of the information that comes into us about services, what we do with it. And I think what we did with the information about the GP services, we collated it, as Catherine said, and we shared that report with the what is now the Thames Valley ICB. And they commission GP services on behalf of their local population, so us, the public. So Thames Valley ICB accepted all of the recommendations in the report and agreed to take them forward, but not just in Oxfordshire, so in Buckinghamshire and Berkshire West. And I think that's just a real example of how your voice can make a difference, by talking to us, by us being able to collate that information, your voice becomes more powerful. I think it was Lord Darcy said the patient voice isn't loud enough. So, we're trying to amplify your voice. So please do continue to tell us your experience of services. We also shared that report with the Oxfordshire Health Overview and Scrutiny Committee, a working group who are looking into GP services across the county and others. I think in terms of signposting, so sometimes people come to us looking for some information, some advice about something they need some help with. And I think a couple of examples, contacted by somebody whose sister was experiencing incontinence and was struggling to afford to pay for incontinence pads. They'd been in touch with the GP, and the GP said no, they couldn't help. They wouldn't supply pads. The lady would have to buy them. But this was causing a real financial problem for this lady. So we advised the caller about the Oxfordshire Bladder and Bowel Service and gave them details on how to contact them. And we also gave her the details of the social prescriber at her GP practice who may have been able to offer some more help and support. I think a second caller, elderly patient, was very upset at the way he felt he was being treated by his GP. And he said he felt anxious and depressed and really put off contacting the GP practice because of how he felt. So we just asked him, what did he want from us? What help could we offer him? And he said he wanted to complain, but he didn't want to go to the GP because he felt that relationship was not there. So we signposted him to the Thames Valley Integrated Care Board, who commissioned those services on our behalf. And we signposted him to an advocacy service who would help him make a complaint. And also thinking about making every contact count and just thinking about listening to him saying how he felt anxious and he was depressed. We signposted him to some support with mental health. And I think sometimes the difference we make, we don't always know what difference we make because we have that in one interaction and people move on. But now and again, people do get back to us and say, thank you again for your time and your kindness. And that was from a signposting response. I think one of the other things we talked about is that, about interpreting services and barriers to care. So we actually did a piece of work with the Oxford Community Champions to develop a film informing people of their rights to ask for an interpreter when attending NHS appointments. The film we produced was shared extensively. It can be found on our website. It's on YouTube. It's on the Healthwatch England website. And I think, again, the so what question, isn't it? So what? And I think, well, the outcome of this award-winning film was it informed people of their rights, it empowered them that when they went to their local NHS service, they knew their rights to ask for an interpreter, and it just empowered them to look after their own health. They were able to be in control, which I think is so important. And I think just to be mindful that this film is available in different languages. So thanks very much for listening to me. And I'm going to hand over to my colleague Jazz, going to talk to you about our work with people and communities. Thanks.
Hi, everybody. I'm Jazz. I've got the best job in the team. I go out and talk to lots of people across the county and build relationships. We continue to engage with those communities who are seldom heard, ensuring that their voices are heard, especially those that live in our 10 deprived wards, where we have built relationships with our communities, local authorities, NHS providers, and the voluntary sector and faith groups. At Healthwatch Oxfordshire, we bring truth to power. We held in Didcot and Farringdon, where we spoke to 30 working men as a part of 30 Chaps Days initiatives. And what they told us was they had issues with cost of living and rent, exercise classes and healthy food, decline of local amenities and services such as podiatry, lack of NHS dentists, difficulties making GP appointments, stigma and stereotype around seeking help. Men often struggle to speak to people. What they told us, what they'd like to see is an environment and a gardening space for people of all ages, better information and help and support and activities, including those who are not online, PS-based testing and better screening for cancer in men. We also go to community centres and libraries and larders, festivals. We've just been to Eid Festival and fairs, and also we go to play days. So at play days, we can reach up to over 80 people. So we're always out and about, going to the people and asking for voices to be heard. So between April and March, we heard more than 800 people living in our rural community as a part of work commissioned by Oxfordshire County Council, focusing on health inequalities. We brought Community First to work with us. I led on the engagement on this, and it was very exciting to do this piece of work. So what did we do? There was 14 rural rural areas that we visited. So in terms of rural, people often think that all rural communities are all the same, but what we heard, and when we went out to speak to people, they're all very different. So ranging from Coropody all the way 52 miles apart to Sonning Common, it was completely different messages that we were hearing. I'd just like to share with you of the focus group that I went to in Charlegrove about inequalities, including food poverty and a lack of social housing. A lot of kids who come to the youth club haven't eaten all day. We charge 20 pence to get in, and a lot of them don't have that. The youth workers feed them as much dinner as they can. The other example that I'd like to share with you is a lack of employment and limited transport. My son got a job in Oxford, but because of the buses, he has to arrive an hour and a half early, and that means he needs to give him 3 days a week because he finishes too late for the bus. So here was real voices that we heard of those people living in the rural areas. The report will be out in June. Slide. We continue to support patient participation groups. We attended 23 patient groups, and here today we've got some amazing chairs who do fantastic work with the PPGs, ensuring that patient voice is at the forefront of the practice. We continue regularly to share news and information and opportunities for PPG members to engage with health and care providers and commissioners. We do 2 monthly bulletins every month. This year was extra special because we worked with Charlebury PPG, who joined us to do outreach visit across Charlebury about the NHS app, which was really good. And this is a great way how PPGs can work with us on how improvements can be made. And here's an example from Susan Smith from Charlebury PPG. It was a great opportunity to talk to patients and hear their comments on this important topic, and we all enjoyed it. Thank you. I'm now going to pass you over to Veronica.
Yes, so we're moving on just to look at some of the comments and feedback we've received here from health and care system partners during the year. And I think what it highlights is Healthwatch's approach to collaboration, to being a constructive and critical partner, so that we can all work together to influence and deliver and drive change. An example being OUH, the Oxford University Hospitals, reports and feedback there go within their governance system and attract the recommendations and changes that we have managed to achieve through working with them are tracked through their governance system in quite a clear and transparent way. So next slide. Here we've just got some of the pictures really about us being out and about at all corners of the county. You'll recognise some of these faces. So we're at the Eid Festival here. We're at hospital stands, enter and view visits, out and about working with the Black Women's Maternity Group on their community research project and with PPG members. The next slide. And here again, I think these comments here from people like in the Integrated Care Board responding to some of the reports we have produced. For example, Heidi Bedall here, who was responding to our women's health report, just how bringing that voice, that lived experience, that qualitative, rich voice into decision makers helps also to inform their strategy and their planning, and to bring in those perspectives so that they can be considered when they are looking at service development. So the next slide is more lovely pictures. Again, enter and view visit to Ashurst Ward, the team out in a cold November day at Farringdon, Keystone Hubs outreach, the fantastic co-production process with the community researchers, the Sunrise Community Research, and again Abingdon PPG there. So next slide is going to hand quickly to Catherine, and then we will open up for questions.
Yes, last but absolutely not least, at the heart of everything we do are the communities and local residents of Oxfordshire. It's a privilege to work with a wide range of groups across the county in partnership, and hopefully these quotes reflect the trust that we've worked hard to build with lots of different communities to create a safe environment where people feel able to share their experiences, know that they'll be listened to, particularly people who have not been heard in the past or may have lost trust in services or experienced over-research, research fatigue, and building that confidence that, yeah, we will not only listen, but also make sure that their voices are heard by decision makers, and to make sure that the research and insight that we gather will lead to real action and real impact, ultimately improving services for everyone in Oxfordshire. Thank you.
So it's over to Barbara now, I think. Barbara? Okay, so I think while Barbara gets online, we're here now listening. Barbara, would you like to say? You need to unmute yourself. Would anyone like to ask any questions? I don't see any questions in the chat, but please, do ask questions. You can either put your hand up or you can directly ask out loud, and we'll find you on the screen of many people.
Sorry, can I will just say something if that's okay?
Yes, Bethia, welcome.
Hi, thank you. And thank you. Saw the photos of Farringdon then. That's really nice to see, and thank you for coming out. And it looked like a very cold day compared to how it is now. I was just wondering, I mean, obviously we're all concerned that the direction of travel of government and the sort of trying to stop Healthwatch and the independent voice of scrutiny on the health system. And I mean, given the changes in central government that are likely to happen in the next week or two, do you think there is an opportunity for any further lobbying under a new central government structure? There'll probably be new ministers and various other things.
Yes, so
sorry,
I can.
Veronica, my apologies for dropping off at that really important moment. Just to start, before Veronica comes in, we have, as an organisation, we have written to all our local MPs, and they are themselves, doing some lobbying on our behalf. But also the Health Overview and Scrutiny Committee has also written out to MPs at this point because of the changes that you've spoken about. Veronica, I don't know if you want to add anything else to that.
Yes, so we have had a lot of support across health and care system and councillors at a district and county council for the principle of independent voice, and I think that's what we're talking about here, because there's other changes, for instance, to hospital governors and that sort of thing. So really it's about that valuing the independence, the trust. So at the moment the Health and Wellbeing Board are also doing a piece of work to look at the future landscape of independent voice, and that report will come to the Health and Wellbeing Board in September. In terms of, I think the bill is going through its committee stages at the moment. I was watching yesterday. The government still seems to be robust on the changes it wants to make, but there certainly is a lot of voice challenging this independent voice. And I think the challenge to the system is about what's going to happen if the changes take place. Is the voices for health will go into the responsibility of integrated care boards, and then for social care into local authorities, whatever shape they're taking, which is in effect sort of splitting that voice across health and social care. So I think the challenge will be, really ensuring, if it does take place, that there's that meaningful listening and working closely with communities, and also that sort of ability to have the trust to come to people, and also with that unsolicited view that will be gathered, not just agendas that are part of the health and care service. So we don't know where we're going, but certainly Healthwatch Oxfordshire, we're here, working very positively and are very hopeful to see how the future rolls out, really.
Yeah. Well, if there's anything I can do, or any of my colleagues, please do amplify that so we can take some action if you need it.
Thank you. Thank you. Do you have any questions from anyone else? Don't know if I'm missing anything anywhere. Carol, are there any questions in the chat? No. Veronica, do you want to sort of finish off by saying a few words?
Yes, I can. Well, thank you everyone for coming on a hot day. I think what we try and do here, and I think because we work with lots of different system partners and lots of communities, you don't always see us in our holistic sort of approach, in that we reach all sorts of areas. So I think, this has been an opportunity for you to get that sort of overview of what Healthwatch Oxfordshire is about. There is a question in the chat from Nazar. What's the best way to engage organisations like University of Oxford as partners in the community-led research? So Nazar and Emily's here, I notice. We are all part of, and you've been to this meeting, the Oxfordshire Community Research Network, which involves also partners from Oxford University. And the County Council and university partners are also doing the Policy Lab, which is working with researchers from university to look at some of the challenges and issues that the County Council are wanting to focus on, particularly around health inequalities. I can talk to you about that when I see you on Friday. There's definitely ways that you can get involved in that process.
Okay, I'd just like to take the opportunity to sort of say, you've heard an awful lot from all the different people in the team about the wonderful work that Healthwatch Oxfordshire is doing. I just wanted to sort of emphasise this is a fantastic team, a small team of really committed people who you can see from the reports given, undertake a huge amount of work and very, very high quality work. And it's so good to get really good feedback from our partners. And I hope you've enjoyed listening to the work that we've been doing over the last year. And just to sort of emphasize that it's business as usual for Healthwatch Oxfordshire, and we will be carrying on doing our work despite the fact that this is a really difficult period with a huge amount of change, which we can't all keep up with. But anyway, thank you all for attending. And Veronica, do you want to say anything else just to finish off?
Yeah, thanks for attending. We're about to produce another report this week you can look out for. That's on end-of-life care. We're out and about listening to people about maternity at the moment, and we're contributing to the discussion around neighbourhood health and how to involve communities better in that. So we're still here, really keen to work with people, and please do come to us if you've got questions or you want to, explore some of the things that you might want to look at as well. Thank you all. This will be recorded on our website, so you can come back to it or share it as well. So I think we'll end the session. You can go and have a cold drink.
Thank you very much.
Thank you.
Cheers, thank you.